called In the Meantime. And it's where therapy is when you realize I'm way over here and this is dysfunctional and I know where I want to get over here, but what do I do in that meantime? How do I get there? And it can be like going through the desert to the promised land. And that's where therapy can really help you not get stuck, bogged down there in that land, because it can be really scary because the coping skills and the systems you used to use, you're leaving them. And you've got to learn, and so you've got to learn new coping skills, new mechanisms. There's a whole new field of DBT therapy. I shouldn't say new, but it's newer. And really, it takes on just the most severe patients, what we call borderline personality disorders, that can be very, very prone to suicide and all these different things. A lot of times, the arts people can have that disorder. But what the whole thing they stress is coping skills, scoping skills. We can go back all day long and go through all your stories, but until you get skills to deal with this, where will you really go in life? And so therapy is about cleaning out that old trash can, okay, but also filling it with good things.
That's
yes. And so sometimes our trash can's full of junk. Sometimes it's completely empty. There's nothing to eat. The cupboards are bare. So people come into me either filled up with too much stuff that is toxic that you never could consume, or they're workaholics that are absolutely empty inside. And I said, did you really think you could give to everyone all your life as a physician and never fill yourself up with anything back? How long career did you think you would have? But I work so much. When will I have time to do that? I said, well, you're not going to be working as much, are you? So sometimes we have to make those sacrifices then to start filling ourselves back up. But with trauma and shame, we're so full with toxic junk. There's no room to put good things in the cupboard. And when we do, it just gets eaten alive or contaminated by the other things.
Yes, and I guess when we learn the skills, when we have the therapy, go through the therapy, and we learn the skills, then we can actually begin that whole process of putting the good stuff in and being able to cope.
And I want to say something about too. I mean, I'm not saying it can't be done without therapy. What I look at is, because I tell my people is, when you start in therapy, I'm going to make myself obsolete. If I can't, I've failed you. I'll give your money back. Okay. What I'm going to do is teach you a process, and eventually you'll be doing this all on your own. Okay. Or you'll do it with your friends. You'll bounce things off of things. A lot of times people will tell me, "Oh, Dr. Tad, I was going to tell you this, but I was thinking about it, and I thought, what would he say in this?" And I thought, oh, he'd be saying this, and they just do it all on their own on the weekend. Or they said, he would say this, but I really thought this would be better. And I thought, that's great. That is better. Because what I try not to teach them is that I'm some expert, that from on high that knows all your answers. Okay. If there's anything therapy has taught me over the years is I don't know your answers. What I know is a process to help you find your answers for you. And thank God, because there's many times clients have come in and what they choose, I would have maybe never chosen. I call it the bicycle wheel, where there's all these little spokes, okay? And usually people come to me because they've gotten to this point where they're trapped in the middle of this bicycle wheel with all the spokes, where they're trying to make this person happy, trying to make that person, their mother happy. And it gets to the point where the decision they've made to please everybody pleases no one, especially themselves. It's a terrible decision. And you come up with something that just makes no sense. And I tell them, what if we got rid of all the spokes? And I said, in a perfect world, what if, depending on it, just be totally selfish right now. If it was only you on an island, what would you pick? What would you want? What would you choose? Just forget all the voices of what people should tell you. Everything says, what would you pick? And what I find is even some of the most selfish, immature people, just really terrible people that have lived terrible lives, make much better choices. Oftentimes very good, wise, spiritual choices when I get rid of all the voices telling them what to do. Okay? And they come up with a decision that I go, wow, that was great. I would not have come up with that one. And thank God I'm not the one picking, but we've got through it and you found the right choice for you. And they go on, they make those choices and their lives bloom beautifully. And I go, thank God the pressure's off of me for making those choices, because I would have really blown it. Okay? So I look at therapy as not, we used to call it coaching. We had executive coaching, those things. But coaching has some negative connotations sometimes that we fear our coaches. We don't want to tell our coach, oh, I didn't do this, I didn't do this. So I tell people when they come in, I said, I'm not your pastor. I'm the person you don't lie to.
Yes.
You know, you may lie to your pastor and not tell them all the truth, but in here, we just come in. There's no shame. I don't judge. It's just what happened, and here we go. Case in point, addicts come in all the time. They said, Dr. Tillemans, you're going to hate me. Oh, my God, I did a horrible thing. What happened? You know, oh, it's just, oh, it's terrible. I've got so much shame. I said, what'd you drink again or something? Oh, my God, yes, Dr. Tillemans. Okay, well, how many days did it last this time? Well, I was drunk for 3 days. So, oh, my gosh, that's fantastic. So we're having a party today. What do you mean? Well, last time it was like a month. We're getting better. Oh, my gosh, this is something with before you, a couple more of these, you'll be down to none.
Yes.
Well, I thought you'd be mad at me and you'd fire me as your patient. Now, how am I going to get you better if I fire you? Okay, what else? Okay, so, you know, but, you know, I tell them, like, I will never fire you. I promise you will never be fired unless you do one thing, you take down another one of my patients. You can destroy your life all you want. I will never fire you. I prefer you did not do that, but I won't fire you. Okay, but you can't hurt somebody else. Okay, but I need this to be a place where you come in, you have no guilt and shame, and you say, okay, all right, just what didn't go, what went well, what didn't work at all, and let's just go through it and figure it out.
Yes.
Okay, and we all need those places. You know,
Yes.
I'd love it to be, and pastors oftentimes want to be that place for their client, you know, because they'll tell me, how do you do that? How do you set up that place? I say, well, you're going to have a big challenge because you've already got church in front of your name.
Yes.
You've got synagogue, you've got mosque in front of your name. And so automatically that brings in their expectations. What they put on you is what we call in my field transference. Okay. Transference is what they bring and put on me. Countertransference is what I put on them. And so they already bring that baggage, put it all on me and say, you're going to judge me. And they'll leave the session going, he was so judgmental. I'm going, I thought you were incredible. I thought what you told me was amazingly courageous to say. I took incredible courage. Where did you get that from? You know, but that's, again, that's their baggage, their trash can that they're bringing in, and they're doing the best they can, but that's the best they can.
Yes. I mean, I think that's really interesting.